New year, new you. Whether you're wanting to lose weight or live a healthier lifestyle, it's hard not to take a look at shortcuts and fad diets.
Especially when you see the ads all over the internet. That's why we had to bring in Dr. Erin Peeden with Ascension St. Thomas to decode some of this for us. Yes. Dr. Erin, what kind of fads are you seeing out there when it comes to diets?
Well, we're certainly seeing like low carb or keto, but I think the main thing that I hear people say is, oh, well, I tried that, and before, and then they give up because it doesn't last.
With the fad diets, you mean like they think it's a quick fix.
Right.
And then it can sometimes even backfire.
Right.
Why are some of these not only bad ideas, but they could actually be dangerous for you?
Well, I think for me, it's what I just said, like they give up, or you get in this mentality of I've been in this bad behavior, or they feel defeated, like they can't get healthier because they lost the weight and then they saw it all come back. And then certainly if you're going through this rapid weight cycling and you're not under the control of a doctor, you can certainly have, issues with their electrolytes or other problems such as that.
Interesting.
Yeah, sparking
imbalance.
Other issues, which when the whole point was to try and get healthy, if you will, but it's again creating more issues. So what kind of age groups are you seeing these fad diets taking place in?
Well, I think really it's, from teenagers on up to adults, and so they'll ask me lots of things about what to do, and so I just try to steer them towards sustainable things that they can do for their lifetime, because that's what we want to get after, especially as doctors, is we're happy to see you, and I'm happy to write you a medicine if you need it, but my goal is to get you healthier and actually off of medicine if we can, in a smart manner.
Absolutely. And unfortunately, I think with a lot of these diets, you end up, whether you lose weight or not, you end up missing out on so many key ingredients or nutrition elements in your diet.
Right. A lot of these diets lack the fiber, and so you can feel bloated and have difficulty with constipation and things like that, or if you're feeling really fatigued, just lots of things. Whereas eating a healthy diet or just eating a healthy lifestyle, you can really start to feel better and have. The biggest thing really is to prevent long-term medical conditions. And so that's what, at least my goal as a pediatrician and an internal medicine doctor, is seeing the kids, is I don't want them to get all the things that we're seeing in the adults. And for the adults, I want to reduce that or get them off some of their medicine if we can, and get them to feeling better longer.
And you're practicing this at home, I hear.
Yes.
And you're kind of showing your children, your child, how it's done. Talk a little bit about that.
Yeah, so last year, my son was diagnosed with a rare metabolic disorder that doesn't have FDA-approved treatment, and so he's going to be, for his lifetime, for his childhood, he's going to be okay, but it's really when he gets older, he's going to get into some issues with some arthritis, but really if he were to develop any of these common issues like high blood pressure and diabetes and were to have an effect on his kidneys, he couldn't process the acid that builds up in his body. So it's really important to prevent those, and so we're doing that by really working on eating healthy at home. And I really want to model that for patients, because a study just got emailed to me today that the increase of type 2 diabetes in patients under 20 years old is going to increase by 673% in the next 3 decades.
Yikes.
Wow. So, under 20.
Shocking.
Yeah.
That's so sad. So what are your tips then? I mean, obviously eating healthy, but what else do you like to tell people if they come to you and say, what do I do?
Well, a lot of societies are recommending is the Mediterranean diet, and that's really avoiding like processed meats if you can, and eating more fruits and vegetables. And I was just talking with someone today about how to introduce more fruits and vegetables to kids and how to make it fun. My son's name is Jack, so I said, we're going to eat Jack today. And so we ate jackfruit meatballs, and so that was fun. But I think overall, like for that patient who felt defeated that they had bad behaviors, I said, no, let's not think of it that way. Let's make a smart goal, which is something sustainable, reasonable, and something you can do in a timely manner, but that's small, and so once that becomes easy, build upon it. So for us, we're trying to reduce our meat, so we do meatless Mondays. That's something, something small to start with, and if that's easy for you, then add twice a week, and that's where my family is.
I like that. Like easy, for lack of better terms, easy to digest steps.
Yes.
And then you can keep going. Thank you so much for being here. We really appreciate it. It's such good advice.
Well, thank y'all for having me.
Absolutely. Thank you.
We're both going to say absolutely. Well, before starting any kind of major diet, always consult your doctor. And of course, you can find Dr. Erin at healthcare.ascension.org.